So what they did is they did some research. The Journal of Neuroscience reported that a university, McGill University, did some research on chronic pain syndromes. And what they found is, and this is specifically for fibromyalgia, but what they found is that the longer that an individual has had fibromyalgia, the greater the gray matter loss or brain matter loss, with each year of fibromyalgia being equivalent to 9.5 times the loss in normal aging. 9.5 times. What this says is if you have a chronic pain syndrome, migraine headaches, fibromyalgia, whatever it is, your brain is deteriorating much, much faster than it should be, folks. This is not good news, and you need to address this and find out what's causing this, because something only goes away when whatever's causing it goes away. So what can we do about this? Obviously, we need to increase the frequency of firing of the network in the brain and work on the areas that aren't working properly. We need to stimulate those mechanoreceptors to help block pain patterns. We need to provide fuel. We need to provide activation as well. So the therapy we do in our office is specific to what's going on with you. It's based on the country's leading chiropractic neurologist, Dr. Frederick Carrick. We might do one-sided adjustment with you. Manipulation, we might do eye exercises. We might do eye light therapy. We might do balance exercises, vestibular stimulation, vibration therapy. It all depends on how much the patient can handle. We don't want to overstimulate the area. We might utilize interactive metronome. Go to interactivemetronome.com for more information. It's a computerized device we have to help increase the frequency of firing of the brain, specifically frontal lobe, and to basically increase the strength of those areas. We might use non-surgical spinal decompression, which is a computerized device we have, a machine that helps basically lengthen and elongate areas that have been compressed in the spine, causing pinched nerves in the body, causing those chronic tight muscles across the shoulders and at the base of the skull that are seen with those fibromyalgia, migraine headache type symptoms. We might use ATM2 therapy, which is a device we use to help rehab these core muscles in the spine that are weak, that are constantly causing this neck to have problems that can lead to you having these migraine headaches. We might utilize this device. This helps retrain the brain to recognize those core muscles again. We can perform this on neck, mid-back, low back, hip, and shoulder issues as well. We might utilize what's called our Avicena Class 4 cold laser. Folks, this is the strongest laser on the market right now, and to my knowledge, we're the only ones that have this in the area. This helps heal tissue. It helps decrease pain, helps decrease inflammation. We use this on trigger points. We use this on carpal tunnel, peripheral neuropathy. Again, helps heal tissue. Go to avicenalaser.com for more information. AVICENNALASER.com for more information. Obviously, we need to assess you neurologically. We need to assess you metabolically as well. We need to run proper and thorough blood tests. Okay, patients who often come to my office and say, "Well, my blood work's normal, doc. Everything's fine." Number one, what they check. Number two, lab ranges vary from where you are in the world, where you are in the state, where you are in the county. Okay, for example, lab ranges are very broad. We're looking at functional ranges. Lab ranges can be different between here in Harrisonburg than they are in Charlottesville, because I've seen it. They can be abnormal and different from here in Harrisonburg than they are in Winchester. So in other words, you might be within normal limits here, but you drive 45 minutes down the road to Charlottesville and you might be outside of their lab ranges, and then you're abnormal. The disease didn't all of a sudden occur. You've just been labeled with the disease now because of the differences in basically lab ranges. So what we need to look at is what we call functional ranges, which is health ranges. If you start approaching outside of these functional ranges, you're going to start to be maybe still within a lab range, but ill health is starting to form, and it might not be diagnosed before you have too much symptoms going on. That's what we need to focus on, folks. For example, if you're looking at what we call a normal TSH or thyroid stimulating hormone, the lab ranges can be anywhere between 0.3 and 5.7, which is very broad. The functional ranges, what is optimal for a healthy thyroid, it should be between about 1.8 to 3. And we can get down the ropes with this, or down the line with this, with your fasting glucose, your A1C, your cholesterol, your triglycerides, same kind of thing. We want to focus on looking where others haven't looked, doing thorough work, and focusing on lab ranges, or rather functional ranges as well. We need to see if you have dysglycemia. It's very common in these kind of headache cases. Abnormal blood sugar, too much or too little. If it's too much, you might be developing insulin resistance, then metabolic syndrome, insulin resistance, diabetes. You might be what we call reactive hypoglycemic. You're skipping meals, and then when you go to eat something, it's very sugary. These are often a contributing factor, in my experience, to migraine and chronic headache cases. but we got to determine these by labs. We look at the adrenal gland. The adrenal gland is the gland that sits above your kidney. That's your stress gland. It's responsible for, number one, stress and cortisol production, which we talked about, but it's also responsible for sugar regulation as well. This stimulates the liver to produce glucose in times between meals. So when you're sleeping at night, to keep you asleep, that adrenal gland kicks in so you don't wake up. Okay, we got to keep that blood sugar sustained. It can also impair peripheral tissue uptake of glucose for energy, which can raise the blood sugar regulation. But people that have chronic adrenal fatigue, that are consuming caffeine, skipping meals, consuming stimulants all the time, all you're doing is you're beating a dead horse to this. You're beating this dead horse is what you're doing, and you're making this condition worse by constantly stimulating that adrenal gland. We need to assess and see if you possibly have any kind of autoimmune condition going on. An autoimmune condition is basically where the body attacks itself. Things like rheumatoid arthritis, lupus, Hashimoto's, thyroiditis. These can be from food sensitivities, leaky gut, genetic malformations, or genetic predispositions. We need to see if you have any kind of intestinal reactions to different foods you're consuming. This is very, very common. We see in our office, and folks, people come to my office and we do these tests and they say, no one else has looked here. No one else has done this test. If you had food sensitivities going on, this is making your condition worse, and you will struggle to get better until you address this. We check for gluten sensitivity, which is found in wheat, rye, and barley, which is more common than you think, and you don't have to have stomach pain to have the problem. We look to see if you have a dairy sensitivity. We look to see if you have problems with yeast, soy, egg. These are sensitivities we're looking at. Again, we have to address this to see if this is contributing to what's causing your health condition. We do blood and saliva testing as well, because we got to determine what is going on with your particular case. Do you have an autoimmune condition? Do you have adrenal fatigue? Are there food sensitivities? Until we address these factors, we're guessing at best. We utilize glutathione in here. Glutathione is the most powerful and prevalent antioxidant in your body. There's tons of research out there on the beneficial effects of glutathione replacement. This neutralizes what we call free radicals. Free radicals are the things that there's an unpaired electron in your body that basically wants to become stable, so it breaks up healthy cells. That can't be good for our body if we're trying to maintain health. The bad news is the older we get, the less we can make. Okay? And you can't take it in a pill form to get glutathione. But what you can do is you can take the precursors of the food to help make more of your own, and what I'll talk about here in a bit. But low levels of glutathione can cause joint inflammation, overall cellular inflammation, which is really the root of disease, is cellular inflammation, joint aches and pains, and chronic illness. Whereas if we can raise these glutathione levels, we can fight a lot of these problems as well. So consuming things such as garlic, onions, and broccoli and cabbage, which has a lot of sulfur in, can help you make more of your own. Exercising, again, some of us with the migraine headaches, it's probably very difficult to exercise. We need to get you to a point where you can do something. That's going to make more glutathione. Selenium, which is found in Brazil nuts, beef, turkey, tuna. Alpha-lipoic acid, found in spinach, N-acetylcysteine. These are the precursors that help us make more of that glutathione, that powerful antioxidant. So basically we utilize functional nutrition with our neurological testing as well, so we can establish the results from your labs to tell you what kind of natural supplements you need to take to get this problem and get you feeling better and get you well. So we're taking all these different pieces of the puzzle, the blood sugar, the abnormal firing of the brain, the cortisol, we're putting together like pieces of the puzzle to make sure it fits well, and then we establish that, and then we basically periodically retest to make sure we're on the right track. So the screening exam that we do is as far as neurologically, is we'll look for a couple different things in your body to tell us what's going on. We'll look for spontaneous eyelid twitching, which is called a blepharospasm. We'll look for kind of swaying with your eyes closed. That's called a Romberg sign. This tells us the brain's very weak and unstable in some of those areas we talked about. We might do a finger-to-nose testing. We might do some optokinetic testing. Different procedures we're going to put you through to see what's going on, which area you're strong in, which area you're weak in. We're going to do a metabolic assessment form. It gives me an overall picture of your overall health, which problems or which systems you're having issues with as well. So this tells us a little bit more of what's going on with your individual case and how to assess this. So folks, you need to ask yourself, number one, how's this condition affected you up to this point? And if I continue down this path that I'm going, what am I looking at long term? What does this cost me in time? What does this cost me in time with my family, time of missed work? What does this cost me in finances? Those are the questions you need to ask yourself. And insanity is doing the same thing over and over and yet expecting different results. I hope this was beneficial for you, and I wish you the best of luck.